So next speaker is Dr. Najva. She will be speaking on Sinonasal carcinoma presenting with orbital apex syndrome.
Okay. A very warm good morning. My topic is sinonasal carcinoma presenting with orbital apex syndrome. Sinonasal carcinoma is rare but aggressive malignancy arising from the nasal cavity in paranasal sinus, and it accounts for 3% of head and neck tumors. The most common pathology associated with sinonasal cancer is squamous cell carcinoma. This cancer is often diagnosed very late as remain asymptomatic until the tumor invades or approaches critical areas such as skull base, nerves, orbit, or palate. Coming to the case, a 56-year-old male patient, smoker, presented with complaints of gradual progressive painless loss of vision and pain in right eye for 3 months. There was a protrusion was seen on the right side of the nose. Visual acuity of right eye was no PL, left eye 624 partial. These are the salient findings on examination. In right eye, there was an eccentric proptosis, an amaurotic pupil, extraocular movements markedly reduced in all positions of gaze. Corneal sensation and facial sensation over V1, V2 area were reduced in right eye. In left eye anterior segment, there was a grade 2 nuclear sclerosis, and otherwise it was within the normal limits. This is the clinical photographs showing limited extraocular movements in the right eye, and the MRI shows soft tissue lesions from the maxillary sinus extending to the orbital apex, encasing the optic nerve. A biopsy was done, and the histopathology report showed sinonasal non-keratinizing invasive squamous cell carcinoma, which is cylindrical cell carcinoma or Schneiderian carcinoma. Treatment: patient was started on chemoradiotherapy, but the patient passed away after 3 months of treatment. What is unique about the case? Sinonasal carcinoma is presenting with orbital apex syndrome is rare, and the histopathology of cylindrical cell carcinoma or Schneiderian carcinoma or transitional cell carcinoma is a rare variant of squamous cell carcinoma. Clinical implications: this case highlights the challenges in diagnosing and managing sinonasal carcinoma and underscores the importance of multidisciplinary care for optical outcomes. Early diagnosis and interventions are crucial in preventing complications and achieving favorable outcomes in patients with aggressive malignancy. The take-home messages: orbital squamous cell carcinoma often occur because of secondary spread, including direct invasion of the nasopharynx, nasal cavity, or paranasal sinuses, or hematogenous dissemination. A prompt diagnosis and multidisciplinary treatment approaches are crucial. Treatment options for orbital squamous cell carcinoma involve single modality or multimodality approaches such as chemotherapy, radiation, or surgical resection. Thank you.
Nice presentation, Dr. Najva.
Thank you, sir.
The thing is that usually sinonasal carcinomas or any form of tumors, there is always a potential of that presenting as an orbital apex. Okay, it's not very rare, but it can present because the way it reaches for the orbit from the inferior, as in from the maxillary sinus per se, there's always potential it goes and moves towards the posterior aspect, reaching the apex very soon. So anyways, it was a very nice presentation.